Thanks, Aubrey, for joining. Everyone, I want to introduce you to Aubrey Hill. Aubrey Hill is the Director of Health Systems Change at CCMU. CCMU stands for the Colorado Coalition for the Medically Underserved, and they've been a partner of Colorado Access for a long time now. So I wanted to give Aubrey an opportunity to tell you about her organization first and foremost, and then some ways that we currently partner with them through our community engagement strategy.
Sure. So CCMU has been around for almost 20 years, and we were originally established by the Colorado Medical Society as a way to look at the gaps in the healthcare system and think about how can we advance some policy solutions and engage communities to address some of the system's challenges that the medically underserved face. Our mission statement is that we create opportunities and eliminate barriers to good health for the medically underserved in Colorado.
So very similar to our mission, you can see why our organizations align with one another, and there's a variety of ways that we partner with CCMU through our community engagement strategy. As a reminder for folks, CCMU kind of falls into this category of a community partner because they're a fellow entity, a fellow stakeholder within the healthcare community that, like I said, has a very similar mission to ours and seeks to better health outcomes for many of the same populations that we serve here at Colorado Access. And there's a variety of ways that we partner with them, and maybe Aubrey, you could share with our staff some of the current work that we're doing together?
Sure, there's a lot of different ways in which we collaborate, and we're really excited to have a partner in Colorado Access. So one of the main ways that we collaborate is in our public policy work. CCMU is really active in the Colorado State Legislature, and we have a policy committee that is sort of our advisory committee to determine our positions on legislation and in trying to determine how it might positively impact the medically underserved or oppose bills that will be detrimental. So it's been really beneficial to have Colorado Access on that committee to really bring in the rich perspectives of the health plan and the different members that you serve. So that is one main way. We also do a lot of work in the community through our network of health alliances. We have 25 formal alliances across the state, and these are local collaborations who work across organizations in local communities, and they really are there to advance solutions locally. Colorado Access has been really active in your sort of region, your catchment area, and you really, as soon as we told you about the health alliances, you were really excited about signing up some staff to attend some meetings regularly. So I know you're really active with Aurora Health Access out of Aurora, Mile High Health Alliance in Denver, and Adams County Health Alliance, and it might be missing a few, but
We've also got several in the Northeast as well that you guys represent, and many of our Northeast delegation represent us at those Health Alliance forums too.
Absolutely. The Northern Colorado Health Alliance comes to mind there. So it's been really great anytime we're doing any projects with them, like creating a summit to talk about high utilizer populations and how we can use different innovations to get these high utilizers connected to the right services. So many people are trying different things, and we wanted to build a summit to come together and see if there's any way we can align and collaborate and learn from each other. Colorado Access has been at that table, so that's been really great.
Well, we've appreciated being at that table, and it's a great opportunity for us to come together not only with CCMU but with a variety of other community stakeholders that you all invite to those forums as well, so that, as you said, we can all collaborate together to find solutions to some of these problems.
Absolutely. There's another policy collaboration that CCMU is co-leading with a number of other organizations called All Kids Covered. And that is a collaboration that has been around for almost a decade. And we really are just trying to come together to make sure that we are reaching our goal of getting 100% of Colorado kids covered. And Colorado Access brings a unique perspective since you are a health plan for kids on CHIP as well as kids on Medicaid. So as we try to come up with different policy solutions to really boost the functionality of those programs, it's been really great to hear that internal perspectives we can identify the solutions and band together and advocate for those solutions at the state level.
We appreciate you having us at those forums, and I know Gretchen McInnes has been particularly involved in that over the years. Myself, I monitor that group as well, and they do very important work for kids.
Mm-hmm. The last thing that comes to mind, or maybe not the last thing, but next to the last thing that comes to mind is our immigrant health work. So in the last year, CCMU has begun working with different organizations in the healthcare field and different organizations who work on behalf or in partnership with immigrants and refugee communities. And we are really learning what the gaps are for coverage and care for immigrant populations in Colorado. And we're hoping that by learning together and really identifying the strengths in that group, we can move forward with the policy solution for immigrants in Colorado. And as soon as I told you about this, you were the first one to sign up. So that's been really great to have that support, especially since this is such a new space for CCMU, and it's not an easy issue to talk about. It's so complex, and the solutions are not going to be easy either. So it's going to be really great to have this partnership as we move with that.
And it's one our staff certainly recognizes as a population that we need to address strategically and with thoughtful partners like yours. So we appreciate you guys leading that conversation and again bringing folks together to the table so that we can have some thoughtful conversations about, you know, what types of solutions can we implement, what's realistic, what's not, and who's going to do what. So we appreciate you inviting us to that table too.
Mm-hmm. I think the last thing, unless I'm missing anything, is the Investing Partner Program at CCMU. It's a relatively new program that we have where different organizations who value the work that we do can be called an investing partner, which means you support the annual meeting and the annual fundraising luncheon event that we have every year. And you're also a member of the organization. And it's really just a statement saying how much you value our work. And Colorado Access was the first one to sign up for the investing partner.
I didn't know that.
Yes, so that was something we were really excited about, and that really showed us that you really appreciate and value the work that we do and the partnership that we have.
Oh, good. So Steph, so you all know that's another way that we've been able to support CCMU and some other organizations, many other community organizations, as well as through some of our small sponsorship, B2B sponsorship dollars. And so that's what Aubrey is speaking to in terms of the investment partner. And I'm pleased to hear we were the first ones at the table and not the last, because I know you've gotten several others to sign on since then. But I think it's an indication of just how much we value the work that you guys are doing on behalf of our members and want to continue this partnership over the years to help those that are most at need.